Hi, I'm Scott Green. I'm one of the surgeons at the Plastic Surgery Center. This is Stacy Lassiter. She's our physician's assistant. She's important in all the parts of your surgical care. Today, we're going to talk about abdominoplasty. Abdominoplasty is three main things that bring somebody in to see us for an abdominoplasty. Usually, extra skin, extra fatty tissue, and a muscular problem. All three of these things are created by babies stretching our body apart. A mommy's body changes a ton when she has a baby, and some of those things don't change back. Mainly those three we just discussed. When we're pregnant, we have hormones that are circulating through our body, and they create hormonally dependent fatty tissue. That fatty tissue doesn't go away after baby's gone. It doesn't go away with exercise, so sometimes only surgical solutions can remove them. Additionally, babies are like little tissue expanders. They're inside of our abdomen and they stretch out our muscular wall of our abdomen. The rectus abdominis muscles are really the ones that most get stretched out, and especially in the middle, this line between them called the linea alba stretches, and it creates what we call a rectus diastasis. And you may have read about that on the internet or heard about that before. But that makes it almost impossible for a mommy's tummy to be flat again after they've had a baby. So, part of our surgical procedure is sewing that muscle back together again. Lastly, babies create extra skin. So often after a mommy's had a baby, she has extra skin in her lower tummy that there's nothing she can do about. No amount of diet, no amount of exercise is going to fix that for her, and therefore surgery is needed to correct it if she wants that fixed. So our job really is to restore a mommy's tummy back to that pre-baby state, if not better if we possibly can, by correcting those three things. Your surgical procedure will go like this. The day of surgery, you're going to come in, we're going to see you, we're going to mark you, we're going to show you what we're going to do, and we're going to take you to the operating room. We'll flip you over, usually, on the operating table so you're lying on your tummy to begin with. And we're going to start your procedure by doing liposuction through your back, flank, and waistline area to help sculpt those areas, especially that flank area tends to be very diet resistant. And so we can really help with removing a lot of that fatty tissue to restore your body to the pre-baby state. Then we're going to flip you back onto your back where you're lying on your back and perform the remainder of the tummy tuck where we're making an incision in your lower tummy. Important thing about that incision is really keeping that incision in the right place. Our bodies are made up of what we call aesthetic units. For example, my arm. This arm is attached in a certain way to my body that looks classically human, that looks aesthetic. Our nose, different kinds of little portions of our face, where our ears attach, where our jawline is, all of those things are aesthetic units. And in the abdomen, there are aesthetic units as well. Our lower abdomen connects to our legs in a particular spot. So where we make that incision in your tummy when we do your tummy tuck is critical in preserving those aesthetic units, not crossing it with our incision. That's how we make our scars hide well, and that's how we make them balance with your tummy for the rest of your life after you've had your surgery. So that incision is made as low as we can make it, and it's as short as we can make it, but it's as long as it needs to be. What that means is if you've got extra skin over on the side by your hip or the side of your pelvis, that's still there and you want that removed, we've got to bring that incision out to that spot to make that go away. Once we do that, we lift the skin up, we then tighten your muscles together, we then put you in a flexed position, and we remove the extra skin and sew everything back together. A critical part of sewing things back together is how we sculpt the area around and how we treat the skin where your belly button's going to be. Belly button's an important part of the abdomen. It's sort of the central focus of the abdomen. So we've got to get that exactly right. Its shape, the contour around it, and everything associated with it has to be just right for it to not look artificial at the end. After we've done all this, you'll be woken up from anesthesia and taken back to our recovery room where you stay for about 2 hours. The whole surgical procedure takes about 2 to 2.5 hours. Your whole time with us in our surgery center will be about 4.5 or 5 hours before you'll be ready to go home. When you go home, it's super important that night, right then when you get home, that you're walking into your house. That's one reason we send people home. Why we don't do these surgeries in the hospital, because patients are going to do better if they're up moving, walking, and in their own home, in their own environment. It's important that you walk in your home that day. It's important that you walk outside the next day. By the second day, you should be walking down your block. By the third day, you should be walking around your block. Why this emphasis on walking? Well, two main reasons really. One, the more you move, the better you're going to feel. That's right, the less you're going to hurt. It makes a huge difference in how you feel. I have patients who come back who haven't walked much and they're very sore 2 or 3 days later. I have patients who have walked and done exactly what I said. In fact, I had a patient just last week and she came in, she was dressed normally, even carrying her purse over her shoulder, and she was only post-op day 3. So she walked and I asked her, "You look great, you're doing so well." She said, "Yeah, I listened to what you said. I walked a lot and I found I felt better afterwards." Makes a tremendous difference. That's one reason. The second reason is blood clots. Blood clots can occur with any surgery and abdominoplasties are no exception. So it's very important after any surgery that you have, whether it be a plastic surgical procedure or any other kind, that you're up walking, moving. Blood clots can form in our legs. They can travel to our heart and stop our heart. That's obviously a complication we cannot have. So we do other things to prevent this sort of thing. We also send you home with squeezy boots. That's what we kind of call them. That's not really what they're called. They're called SCDs, sequential compression devices. But they're designed to squeeze your calves and make sure it's pushing blood back through your system, back to your heart to prevent blood clots. So you have those the first day or two while you're at home. But having those does not mean you can't walk. It's not 100% cure of a blood clot to have an SCD. So walking really is the cure. That's your primary responsibility when you go home. Make sure you're moving. That's going to make all the difference in the world in your recovery. Usually by about day 3, you can do most stuff on your own, but for those first 3 days, you do need some help when you've had an abdominoplasty. You need help doing some simple things, even just like getting out of bed the first time, or going to the bathroom, or taking a shower, which usually you do on day 2 or 3 after surgery. So you do need help those first few days. It does need to be somebody who's responsible and able to really give you good help. After day 3, it's better if they don't help you too much. It's actually better if you do a lot of it yourself. The more you have to get up and do for yourself, the better you're going to do. Usually by day 3 or 4, patients will tell me, "I have it now, I can do it." By a week, most people are off of pain medicine, can drive a car, and your drains come out. So when we do an abdominoplasty, we do place drains typically. Why do we place drains? You may have read that some people don't use drains in abdominoplasties. Well, I do it sometimes with, sometimes without, but most of the time with. And the reason is swelling. Swelling causes pain. Pain keeps you from moving, keeps you from walking, and in my opinion, increases your risks, as well as obviously your discomfort. The more pain you have, the less you're going to do, and the more miserable your experience is going to be. Our goal is to keep you pain-free. So we do place drains during surgery, and we do put you in a compression garment after surgery so that will squeeze all of the swelling out of that area and that you're more comfortable. Additionally, that compression garment that we place you in, that needs to stay on for 6 weeks, and it does so for the 2 reasons. One, the drainage and the swelling, and secondly, because that compression garment helps support your muscle repair that we've done. That extra compression on your muscles supports them because the stitches by themselves aren't strong enough to hold things in place, so scar has to form to take care of the rest of that. Also, in the past years, since the medication has been developed, Exparel, that's the medication, we've been using Exparel in abdominoplasties. Exparel is a way that we can help our patients be more pain-free and get up and move quicker. We inject Exparel into your muscles and into your incision lines during your abdominoplasty, and that is a long-acting pain medicine that helps us prevent pain for you post-op, decrease your use of narcotics, and help you get through this experience without too much trouble. Additionally, you'll have some medications that you will be sent home with during your pre-op. Those medications typically involve one pain medicine, a narcotic type, most often something like Norco, an antibiotic that we send you home with for 3 days, usually cephalexin or Keflex. If you're allergic to that antibiotic, we find another one for you. And we send you home with an anti-nausea medicine, Zofran typically, also called ondansetron, that's its generic name. And you take the pain medicine and the Zofran on a sort of an as-needed basis. It may say every 4 hours on there, but you don't have to take them every 4 hours. It's what's actually needed. The antibiotic's a little different. You take that as it's prescribed 4 times a day. Usually by about a week, again, you're kind of cruising pretty good and doing most stuff on your own, but still a little tired, not able to put in a full day's work. It usually takes about 2 weeks before most people are able to go back and do a full day's work at an actual job. Some of you folks who are lucky enough to work at home now may be back at work a little sooner than that. Moms with babies, I get asked this question all the time. When can I take care of my kids again? When can I pick up my baby? You can pick up your small baby right away. It's no problem picking up your baby, putting him in their crib and taking care of some simple things like that, even the first week. Typically by 2 weeks, you're going to be going back to work, driving a car and doing all that. And certainly after that week, between the first and second week, you should be able to pick up your kids, help them to get in their car seat and help do some simple things for them. By 3 weeks, most of you can go back to the gym at that point if you exercise. And if you don't exercise, you should. Exercise is good for you. So you can go back to the gym and start doing things like cardio exercise, treadmills, stationary bikes, ellipticals, and even light arm weights. I do keep you from doing strong core workout until you're 6 weeks out. At 6 weeks out, all restrictions are removed, but we do prevent the strong core workout until that 6 weeks because the muscle repair isn't completely strong by then, until then. And that's the same reason we keep you in that compression garment for that period of time, so that that muscle repair can be nice and strong. Your body has by then formed scar tissue that is now lining that area where we put those stitches. And after 6 weeks, your tummy will be stronger, frankly, than it ever was before. In fact, I've had patients get pregnant years after I've done their abdominoplasty and their muscle repair holds together. At 6 weeks, you're free to go. And after that, no more restrictions. You're back to being normal with your new body. That's abdominoplasty.